80% of our health dollar goes towards caring for chronic conditions. And we know our health dollar is one of the big factors that's driving the deficit and threatening the future solvency of America. It's why we need the Affordable Care Act. I hope you don't mind my saying that. I think it's important. It might need fine-tuning, but it's important. So almost everybody, by the time they reach that golden age of 65, has at least one chronic condition. Anybody in here that doesn't have something that's, she's perfect. I love it. Would you mind coming giving the talk? I'm imperfect. I have a little bit of arthritis. I don't know, a little of this, a little of that. Most of us have something. So, but one of the things we see is it's not so bad having it. You can learn to manage it. But it shortens your life. And we're in favor of aging, then we're in favor of longevity. Positive longevity, happy long life, right? We're all in favor of that. And yet we see in America that the things that are taking people out at the end of their time are modifiable risk factors. They're things that we could have done something about. Smoking used to be the big killer. Okay, well, most of us gave it up, right? Nobody in this room would now admit to smoking, probably. Oh, but obesity and physical inactivity in our society have come to surpass smoking as a cause of death. So these fundamentals are serious. They drive illness, they lead to premature death, and mostly they kind of make people feel bad, you know? I mean, really, positive aging is about being like you guys, energetic, upbeat, involved, engaged. So very important. And look at all the bad things that come from bad lifestyle or a lifestyle that could be improved. We can see, we know diabetes is like epidemic. Certainly breathing conditions and heart problems, arthritis and cancer. These are all around us all the time. And the other result of the widespread prevalence of chronic conditions that we think could be mitigated and could be made more manageable is the impact on us neighbors and family and friends. Now, this talks about the burden of caregiving, I hasten to add, because we're all full of social engagement. Of course, caregiving is a privilege and a bonding experience. It's just that our society is not really set up for the extended and extensive caregiving demands that have currently shifted from a longer hospital stay to, and from shorter, more curable medical conditions to these extended, you know, you say, Mom, come with me. I want you to be with me. That was fine for 3 years, but for 20? I love Mom, but do you want her to be there for 20 years? Does she want to be there for 20 years? So these issues are impacting on people's lives. I bet, I don't know, everybody in the room got someone they're worried about right now and probably having to pay some attention to, be involved in, assist, short-term or long-term. I mean, it's everywhere. Every cocktail party you go to, you say, how are you? And they say, fine. And how are you really? Out it comes. These issues are important. And these things are impacting us. It impacts our health. These things have a direct effect on the caregiver if it's extended and intensive. And some of the dementias are particularly disruptive, I think, to lifestyle where you have still the person present but not the personality. And so you have this very confusing circumstance and very complex to manage. And we're seeing a lot of that. So maintaining your brain, whew, number one, huh? So just to review then, the determinants of health, which are also the determinants of non-health, we see the biggest piece there is behavioral patterns. So that means we can all work to inspire ourselves and those we love because, look, environmental exposures, which we're concerned about, not so big. Social circumstances, well, that's in there. Predisposition, well, what can we do? We got the genes. We have to live with that. Healthcare, look at the small percent of impact healthcare has. So that would say, okay, that's good news. That's something we can do something about, right? We have the ability. Whoop, I skipped a slide, I'm sorry. There we go. Oh, I just found this. I don't know if you've seen this. I was reading a new study by Brigham Young University. They did a review of 140 research projects, a meta-analysis. And they came up with this conclusion that social interaction, and that's actually written wrong because it's a brand new slide, it's actually an important factor to extend lifespan, and it can shorten lifespan because they're saying, and let's go back to your positive attitude, which comes usually from not being alone, trapped by yourself and out of touch with others, but with having, not necessarily, they said being married was neutral. It didn't make it better or worse necessarily in and of itself. It's the social interaction. And so family, friends, colleagues, groups like this, you know, this is like going to camp, right? This is so sweet. Come every year, find those people, stay in touch, these kinds of things. Like Peter and I, we hadn't seen each other for 10 years, but we went to these kinds of meetings. It's like hot, you know, you have those people you just pick right up. Well, so those kind of relationships are critical to positive aging. So good news is we can actually change behavior. It isn't easy, and we can sustain it. We can manage chronic illness to a large degree and improve quality of life. So we can age positively. Now, this is just the health side. You're aging positively with all these other wonderful and very important aspects. So how do these positive or negative changes work? Change, we notice, especially in our society, it takes quite a lot of time. It's interesting how slow it is. And you have to remember when you hear this that you're usually in the middle of a change process. So don't think when we say that change takes 17 years. A major change in our society takes 17 years. So, wow, I'm a change maker. I'd better live to 100. It's going to take that long. Well, it might. We're talking about the same issues we talked about in the 80s, right? But now they're of interest in our society. These issues are much more in vogue. So we can look on the downside, you know, we had smoking, but look what happened. The upside was California. I don't know where you're from, if you've seen a radical decline in smoking, but in California, with many people working very hard in changing rules and making like nobody dare smoke in this room, right? Now, when I was going to college, you could smoke everywhere. Airplanes, classrooms, movie theaters. Ew, serious. Now, forget it. You can't do it. So with a variety of forces, that dangerous and horrible behavior has been mitigated. So it shows that it's really worth it to make the effort. On the other hand, and a friend of mine looked at this and joked and said, well, maybe these two are linked. I hope not. That is, we reduced smoking, we all gained weight. Darn it. Now, I know you didn't, and I knew when I looked at the program, I said, there's not going to be any people here who are overweight. So congratulations, you all look excellent, healthy. But in our culture, as you know, and I couldn't get the slide, but there's a wonderful set of slides that show every 10 years in America, and it shows going from a low rate of obesity to this rather frightening level. These darkest colors on here are states that have obesity levels of 30%. And the lighter brown ones are like 20%. So these are serious issues. And you can look at the difference in the size of a bagel 20 years ago and the size of a bagel now. Or you could look at a difference in the size of a hamburger that you buy. You know, those ads they show, these like monstrous. And it's good, so it's hard not to eat it, right? So we see that our culture somehow shifted, where we have kids who are much more sedentary. We have adults. We have safety issues. We have all kinds of issues that lead, but part of it is just portion size. And I didn't notice, did you? I mean, it sneaks up on us. So there's very interesting things dietitians can show you about the change. So obesity, in the same period of time that smoking in California dropped way down, obesity is shooting way up. And it, of course, is a terrible, terrible threat to health. So those are things we can do something about, though. I mean, you go lots of places now. You know, we're taking sodas and bad foods out of our school systems. You know, we're improving the food we have at international conferences on positive aging. You know, we're looking at all of that. So we're going to talk a little bit, though, about how we as individuals change. So part of the vision of the future out of that then is systems change, or what I call system change. I mean, we have to kind of like change the way things are done by many. It'd be really good if you change what you're doing and I change what I'm doing, but if we change what we're doing and what they're doing, it's going to be better. It's going to have a lot more modeling influence for young people, and makes it a lot easier. You know, you go through life in our culture and try to eat responsibly, and it's really hard if you're outside your house. It's difficult. You've got to find someone who will split the meal, whatever. So as we look at this, one of the things we want to look at is the health care system. And then we want to start looking at not just individual outcomes, but how is a population doing? How is a whole town? At the end, we'll look at how a whole town is doing, how a whole country, how a whole state is doing, and can we improve those results, which means we're changing the individual lives. So, you know, what we've had now is a medical system that medicalizes a lot of these issues, and we have a system that relates to patients around a presenting problem. You go to the doctor when you think you should, or when you can get a friend to go there who should go but won't. And the doctor looks at the part that you're reporting. Doctor, my arm hurts. So they look at your arm. But really, health comes from a whole person. The arm is attached to someone, and the someone lives in a social and environmental circumstance. And those social determinants of health, which is a lot of what we're talking about today, are at play. So the individual and the social determinants of health that surround them are what lead to the health issues. And